Your healthcare provider prescribed Bezremi, ropeginterferon alfa-2b-njft, an injectable medicine. Today, you'll learn how to prepare a dose, assemble the syringe, prepare for and give yourself the injection, and dispose of the syringe afterward. Be sure to check with your healthcare provider each time you get your medicine because your prescribed dosage may have changed. You may want to ask a trusted person to watch this video with you. That way, they can understand what you need to do and support you along the way. A few other quick tips. If you wear reading glasses, grab those now. It's also a good idea to have all of your supplies on hand. We will be referring to each item as we walk you through the injection process. This way, you can make sure you have everything you need. What is Bezremi? Bezremi is a prescription medicine that is used to treat adults with Polycythemia Vera. Important safety information. What is the most important information I should know about Bezremi? Bezremi can cause serious side effects that may cause death or may worsen certain serious diseases that you may already have. Tell your healthcare provider right away if you have any serious side effects during treatment with Bezremi. If symptoms get worse or become severe and continue, your healthcare provider may tell you to stop taking Bezremi. These symptoms may go away in some people after they stop taking Bezremi. Please see additional important safety information at the end of this video and full prescribing information, including boxed warning and medication guide, available at BESREMi.com. In a moment, you will hear from Chris, who is going to walk you through the injection process. But first, let's take a closer look at your pre-filled syringe and needle. As you can see, each part is clearly labeled. You will find this image in the instructions for use that came with your prescription. Proper storage of your Bezremi pre-filled syringes is very important. Here are some important instructions for storing your Bezremi. Store the Bezremi carton in a refrigerator between 36 to 46 degrees Fahrenheit, 2 to 8 degrees Celsius. Keep your Bezremi pre-filled syringes in their original carton while stored. Do not freeze the pre-filled syringes. Do not use a pre-filled syringe that has been frozen or left in direct sunlight. Keep Bezremi pre-filled syringes, needles, and all medicines out of the reach of children. Here are a few other things to keep in mind as we get started. Read the instructions for use before using your single-dose Bezremi pre-filled syringe for the first time and each time you get a new prescription. There may be new information. The instructions for use leaflet does not take the place of talking with your healthcare provider about your medical condition or your treatment. Ask your healthcare provider about the right way to prepare and give your Bezremi injection. Your healthcare provider will tell you the prescribed dose that you should take and the right amount of Bezremi to measure in the pre-filled syringe for your dose. Each time you inject, be sure that you know the prescribed dose of Bezremi to inject. Your dose may change over time. Bezremi is for subcutaneous, under-the-skin injection only. Bezremi is for one-time use only. Do not reuse your pre-filled syringe or needle. Do not use a pre-filled syringe or needle that is damaged or broken. Contact your healthcare provider or pharmacist for a replacement pre-filled syringe or needle. Inject Bezremi into the top of the thighs or lower stomach area just under the skin. Do not inject Bezremi into any other area of the body. Throw away the Bezremi pre-filled syringe and needle right away after use, even if there's medicine left in the pre-filled syringe.
Hi there, I'm Chris. Today, I'm going to walk you through self-injecting Bezremi. It's understandable if you're feeling a little bit nervous about the process, but don't worry. I'm here to show you, step by step, how to use Bezremi. You'll get the hang of it. Please note that this video doesn't include complete instructions, so be sure to read the instructions for use and the full prescribing information that come with your Bezremi carton before using it. And please talk with your healthcare provider about any concerns you may have. Also, be sure to watch this entire video before injecting Bezremi. Now, let's get started. Take the carton that contains the Bezremi pre-filled syringe out of the refrigerator. Be sure to check the expiration date on the carton. This is labeled EXP on the top panel of the carton. Make sure the date has not passed. Do not use the pre-filled syringe if the expiration date has passed.
Keep the pre-filled syringe in the carton and let it sit on a clean, flat work surface for 15 to 30 minutes to allow it to come to room temperature. Do not warm the syringe in any other way.
After allowing the pre-filled syringe to come to room temperature for 15 to 30 minutes, gather the rest of your supplies. This includes an alcohol swab, an FDA-cleared sharps disposal container, a paper towel, and trash can to minimize mess during the dose adjustment, a gauze pad or cotton ball, and an adhesive bandage. Now, thoroughly wash your hands with soap and water, then dry them with a clean towel, and you're ready to begin. First, open the Bezremi carton and remove the clear plastic tray that holds the Bezremi pre-filled syringe and needle package. Now remove the needle package and Bezremi pre-filled syringe from the plastic tray. Be sure to hold the pre-filled syringe by the middle of the syringe body while removing it.
Next, check the liquid medicine in the pre-filled syringe. The liquid should be clear and colorless to slightly yellow and should not have particles in it. Do not use the syringe if the liquid is cloudy, discolored, or contains particles. If you notice any of these, contact your healthcare provider or pharmacist. Be sure to check the syringe for damage and do not use if it shows any signs of damage or breakage. Contact your healthcare provider or pharmacist to let them know.
Now you're ready to prepare the syringe for injection.
Begin by carefully opening the needle package, removing the needle, and setting it on a clean surface. Throw away the packaging into the household trash. With one hand, hold the syringe like this. Remove the pre-filled syringe cap by unscrewing it counterclockwise. Throw away the syringe cap into the household trash. Do not allow the tip of the pre-filled syringe to touch anything. Attach the yellow end of the needle to the pre-filled syringe by firmly pushing it into the collar of the syringe. Then screw it on, turning clockwise until it feels securely attached.
This is what the syringe will look like after you finish attaching the needle. Now, we're ready to go through a few steps on how to inject Bezremi. It's important that you watch this entire section before you proceed with your injection.
There are a couple of areas you can inject, either under the skin of your lower stomach, at least 2 inches from the belly button, or at the top of the thighs. It's important that you avoid injecting into skin that's irritated, red, bruised, infected, or scarred. Bezremi is only to be injected under the skin, subcutaneously.
Today I'll be using my thigh. Make sure to use a different site each time you give yourself an injection. Now you need to clean the area you plan to inject with one of the alcohol swabs. Once your skin is air dried, you're ready to start preparing the syringe.
Pull the pink needle shield back. Do not remove the needle shield from the syringe. You'll use this after the injection to cover the needle and protect against needle stick injuries. Hold the syringe from the syringe body. Remove the clear needle cap by pulling it straight off. Be sure to throw away the needle cap into household trash. Do not recap the needle. Next, remove any air bubbles from the pre-filled syringe. Hold the syringe with the needle pointing toward the ceiling. Then, gently tap on the body of the syringe to bring any air bubbles to the top.
Next, let's look at how to measure your prescribed dose. This is very important. So before we get into specifics, let's check what your dose is. I'll give you a moment to check your prescription now.
When setting your dose, you'll need to line up the top outer edge of the gray stopper with the specific dose line and number on the syringe that matches your prescribed dose. Do not line up the dome at the top of the stopper with the dose line. Remember, check your prescribed dose before injecting Bezremi. Depending on your prescribed dose, you may have to adjust the dose in the syringe, by getting rid of some of the medicine from the pre-filled syringe before you inject.
For example, my dose is 100 micrograms. Because it's less than 500 micrograms, I need to press the plunger to push out some of the medicine to get to my dose. Here's how to set your dose properly. First, hold the pre-filled syringe at eye level with the needle pointing straight up over a paper towel, sink, or trash can. Check that you can see the dose lines and number markings on the pre-filled syringe. Then pinch the end of the plunger. Slowly push up on the plunger to remove liquid medicine until the top edge of the gray stopper lines up with the marking for your prescribed dose. Be sure to keep holding the syringe straight up as you set the dose. Don't worry if you get medicine on your hands while measuring your dose. You can wipe your hands off with a paper towel or wash them when you're finished. Importantly, if you accidentally remove too much liquid, do not inject. Contact your healthcare provider or pharmacist. Once you have your specific dose measured in your syringe, you're ready to inject Bezremi.
Pinch a fold of skin on the chosen injection site firmly with your thumb and forefinger. Insert the needle at a 45 to 90 degree angle into your skin. Then release the pinched skin. Inject the medicine by slowly pressing down on the plunger all the way until it stops. After all the liquid medicine is injected, remove the needle from the skin. Now, make sure you cover the needle. Carefully push the pink needle shield over the needle until it snaps into place and covers the needle. This helps prevent needle stick injuries. Do not recap the needle using the needle cap. Only use the pink needle shield to cover the needle. Do not reuse the pre-filled syringe and needle. To prevent needle stick injury, it's important to safely dispose of the used syringe and needle. Always dispose of the used syringe and needle after use. Never use the same syringe or needle more than once.
Put your used pre-filled syringes and needles into an FDA-cleared sharps disposal container right away after use. Do not throw away loose pre-filled syringes and needles in the household trash. If you don't have an FDA-cleared sharps disposal container, you may use a household container that is made of heavy-duty plastic, can be closed with a tight-fitting, puncture-resistant lid that can prevent sharps from coming out, one that is upright and stable during use, leak-resistant, and properly labeled to warn of hazardous waste inside the container.
When your sharps disposal container is almost full, follow your community guidelines for the right way to dispose of it. There may be state or local laws about how you should throw away used needles and syringes. Do not recycle your used sharps disposal container, and always keep the container out of reach of children. If there is a small amount of blood or liquid at the injection site, press a gauze or cotton ball over the injection site until the bleeding stops. Do not rub the injection site. If needed, you may apply a small adhesive bandage. Important safety information. What is the most important information I should know about Bezremi? Continued. Mental health problems, including suicide. Bezremi may cause you to develop mood or behavior problems that make it worse during treatment with Bezremi or after your last dose, including irritability, getting upset easily, restlessness and agitation, confusion, depression, feeling low, feeling bad about yourself, or feeling hopeless, unusually grand ideas, acting aggressive, acting impulsively, or thoughts of hurting yourself or others, or thoughts of suicide. If you develop any of these symptoms, you, your caregiver, or family member should call your healthcare provider immediately. Your healthcare provider should carefully monitor you during treatment with Bezremi. New or worsening autoimmune problems. Bezremi may cause autoimmune problems, a condition where the body's immune cells attack other cells or organs in the body, including thyroid problems, increased blood sugar, hyperglycemia, and type 1 diabetes. In some people who already have an autoimmune problem, it may get worse during your treatment with Bezremi. Tell your healthcare provider if you have tiredness, are urinating often, or if you're very thirsty. Heart problems. Bezremi may cause heart problems, including problems with your heart muscle, cardiomyopathy, heart attack, abnormal heart rhythm, atrial fibrillation, and decreased blood flow to your heart. You should not use Bezremi if you have high blood pressure that is not controlled, congestive heart failure, a serious abnormal heart rhythm, narrowing of the arteries to your heart, certain types of chest pain, angina, or a recent stroke or heart attack. If you have a heart problem before you start using Bezremi, your healthcare provider should monitor you closely during treatment with Bezremi. Who should not use Bezremi? Do not use Bezremi if you have or had severe mental health problems, especially severe depression, thoughts of suicide, or attempted suicide, have or had a serious or untreated autoimmune disease, have had a serious allergic reaction to another interferon product or to any of the ingredients in Bezremi. Symptoms of a serious allergic reaction may include itching, swelling of your face, tongue, throat, trouble breathing, feeling dizzy or faint, and chest pain. Have certain types of liver problems, have received a transplant, and take immunosuppressive medicines. Before using Bezremi, tell your healthcare provider about all of your medical conditions, including if you are being treated for a mental illness or had treatment in the past for any mental illness, including depression, and have had thoughts of hurting yourself or others, have type 1 diabetes, have or ever had any problems with your heart, including heart attack or high blood pressure, have or ever had bleeding problems, a blood clot, or low blood cell counts, have a condition that suppresses your immune system, such as certain cancers, have hepatitis B or HIV infection, have kidney or liver problems, are pregnant or plan to become pregnant. Bezremi may harm your unborn baby and may cause loss of your pregnancy, miscarriage. Before you start using Bezremi, your healthcare provider should do a pregnancy test. You should use effective birth control during treatment and for at least 8 weeks after your final dose of Bezremi. Talk to your healthcare provider about birth control choices for you during treatment with Bezremi. Bezremi can affect your menstrual cycles and may cause your menstrual periods to stop. Tell your healthcare provider if you become pregnant during treatment with Bezremi. Are breastfeeding or plan to breastfeed? It is not known if Bezremi passes into your breast milk. You should not breastfeed during treatment and for 8 weeks after your final dose of Bezremi. What are the possible side effects of Bezremi? Bezremi can cause serious side effects, including decreased blood cell counts. Your healthcare provider should check your blood cell counts before you start and during treatment with Bezremi. If your blood cell counts are too low, you can develop anemia, infections, or have problems with bleeding or bruising. Call your healthcare provider right away if you develop weakness and tiredness, bruising easily, nosebleeds often, fever, chills, burning and painful urination, urinating often, or coughing up yellow or pink mucus, phlegm. Serious allergic reactions and skin reactions. Get medical help right away if you get any of the following symptoms: skin rash or hives, itching, swelling of the face, eyes, lips, tongue or throat, trouble breathing, chest pain, or feeling faint. Eye problems. Bezremi can cause severe eye problems with your retinas that can lead to vision loss or blindness. You should have an eye exam before and during treatment with Bezremi if you have diabetes or high blood pressure and also have retinal problems. Your healthcare provider may stop Bezremi if you develop new or worse eye problems during treatment with Bezremi. Liver problems. Bezremi can cause increases in liver enzymes and liver damage. Your healthcare provider should do blood tests to monitor your liver enzymes and liver function before you start and during treatment with Bezremi. Kidney problems. Your healthcare provider will do blood tests to check your kidney function before starting and during treatment with Bezremi. Tell your healthcare provider right away if you develop any symptoms of a kidney problem, including changes in the amount or color of your urine, blood in your urine, swelling in your ankles, or loss of appetite. Your healthcare provider may stop Bezremi if you develop severe kidney problems. Tooth and gum periodontal problems. Bezremi can cause tooth and gum problems which can lead to tooth loss. Bezremi can also cause problems with dry mouth that can damage your teeth and the lining of the mouth during long-term treatment with Bezremi. It is important for you to brush your teeth well 2 times each day, and have regular dental examinations during treatment with Bezremi. Skin problems. Bezremi can cause skin problems. Signs and symptoms of a skin problem with Bezremi include itching, hair loss, rash, redness, psoriasis, acne, thickening of the skin, or excessive sweating. Call your healthcare provider if you develop a rash that is bothersome or covers a large skin area. The most common side effects of Bezremi include flu-like symptoms, including tiredness, weakness, fever, chills, muscle aches and joint pain, itching, sore throat. For additional information about Bezremi, go to www.bezremi.com. Please see full prescribing information, including boxed warning and medication guide for Bezremi, included in your Bezremi carton.
Thanks for watching this video on how to inject Bezremi. I hope you found it helpful and that you now feel a little more confident about giving yourself injections. If you need more injection training, our dedicated Pharma Essentia source nurse case managers are here to help. Please call 800-700-5053 between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday.
If you have any questions, call Pharma Essentia Medical Information at 800-999-2449 for help.